Everyone, and thank you for tuning in to today's webinar. I'm Lauren Diffendarford, the medical educator here at the DIS Foundation, where our primary mission is to empower people to save lives. Today we're going to go over how to use an AED on children and infants. So to begin, let's go over what an AED exactly is. AED stands for Automated External Defibrillator. An AED analyzes a heart rhythm and determines if the rhythm is shockable. If the rhythm is shockable, it will advise a shock. Otherwise, it will prompt the rescuer to continue performing CPR. If the rhythm is shockable, the AED will stay so and charge. The rescuer can then hit a button to deliver a shock. The shock basically resets the heart rhythm so that it can beat normally and effectively again. An AED should be used early on during a resuscitation attempt because it improves the victim's chance of survival. We want to show you just how easy it is to use an AED. So to use an AED, start by turning on the device. Expose the chest of the victim. Apply the pediatric-sized pads on the victim. Do so by peeling off the backing. Place the pads on the chest following the diagrams on the pad. One right below the right collarbone and one to the side of the left nipple, slightly below the armpit. For infants and smaller children, you may need to place one pad on the chest and the other on their back. If pediatric-sized pads are not available, adult pads may be used. Make sure the pads do not overlap. Connect the pad's cables to the AED device. The AED will begin assessing the victim's heart rhythm. Clear the victim. No one should be in contact with the victim during this time. You may need to hit a button to let the AED begin analyzing the heart rhythm. Once done, the AED will prompt you on what to do next. Follow the AED's prompts. If it says shock advised, it will tell you to clear the victim as well. Do so, and once the AED is charged, hit the shock button to deliver the shock. Make sure prior to delivering the shock that no one is in contact with the victim. Once the shock is delivered, resume CPR. If the AED prompts no shocks advised, immediately resume chest compressions. The AED will reanalyze the rhythm after about 5 cycles of CPR. If the AED says check electrodes, make sure the pads are connected correctly to the victim. Lastly, if the AED has a pediatric setting, this should be used. Otherwise, the adult setting can be used. Some situations require extra steps before AED can be used. For victims in the water, you should pull the victim out of the water prior to AED use. Wipe the chest before applying the AED pads. It is safe to use the AED if the victim is lying on snow or in a small puddle. Just make sure the chest is dry. Also, do not place AED pads directly over a medication patch. You may also remove the patch and wipe the area before applying the pads. Don't forget we offer online CPR certification. You can find a link in the description. We encourage you to become certified as soon as possible, either in a classroom or on your own time with an online course. Thank you again for tuning into our webinar. Catch us later for our next webinar on how to use a bag mask device. If you have any questions, please feel free to comment below. Thank you.